On a busy day at the Naval Medical Center, an osprey lands carrying a seal, agonizing from a severe chemical exposure. Without hesitation, Nora Whitlock, the rookie nurse humiliated by everyone in that hospital, runs to the stretcher and delivers the wounded soldier's first emergency care. When the chief surgeon sees the scene, he unleashes an aggressive shout to punish and belittle the poor nurse, until a SEAL operations commander escorting the soldier says only 2 words directed at her. 2 words that silence the surgeon and reveal that this rookie nurse once commanded operations he was never supposed to walk out of alive. The price of her secret had always been silence. This time, silence would kill the man on the stretcher. What happened next paralyzed the entire team of that great naval hospital. Before this story pulls you under, do me one small favor. Hit that like button so this story reaches the people who need to hear it. And in the comments, tell me what city or country you're listening from right now, because I read every single one. If you just landed on Silent Badge's stories, welcome. You're home. Subscribe and stay close, because here we tell the stories the world prefers to keep buried. Now let's begin. The Naval Medical Center San Diego, called Balboa by everyone who worked there long enough to stop using the official name, sat on the high ground above the bay in a complex of pale buildings that had absorbed nearly a century of military medicine into its walls. The morning fog moved in off the water and settled around the helipad at the eastern edge of the campus before the sun burned it away, and by the time the first shift of corpsmen arrived for the day, the wind had already shifted on shore and the salt was in the air the way it always was at that hour. Nora Whitlock had been at Balboa for 14 months. She came in at 5:30 each morning, badged through the East employee entrance, and walked the long corridor to the trauma and emergency wing with the particular quiet efficiency of someone who had built a routine and had no interest in disrupting it. She was 35 and looked like a woman who had spent a great deal of her life outdoors without making a point of it. Her hair was dark brown, kept long enough to gather into a low ponytail at the base of her neck. Her eyes were green in the precise way that some maps were green. Depth without warmth, attention without performance. Lean in the running way rather than the gym way, 5'7", she moved through the corridors of Balboa with a posture that the staff who knew her had eventually stopped trying to read. There was a thin diagonal scar on the outside of her left forearm that she had once explained as a kitchen accident from her teenage years, and a small burn scar tucked behind her right ear that no one had ever asked about. The personnel office had her resume on file. It was complete and unremarkable. 2 years in a civilian emergency department in Tacoma, 4 years at a clinic in Northern Virginia, listed under contracted federal medical services, and a 6-year period before that, filled in with the kind of general phrasing that satisfied a hiring system and did not invite follow-up. No one had ever followed up. The trauma and emergency wing at Balboa was its own particular ecosystem. The hospital served active-duty sailors and Marines, their dependents, retirees, and the occasional civilian transferred in from incidents that fell into the Navy's jurisdiction. The day shift was led on the floor by a senior charge nurse named Diane Royer, a woman in her early 50s who had been at Balboa for 19 years, and who ran her floor with the disciplined warmth of someone who had decided a long time ago that being competent and being kind were not contradictions. The night shift was harder. The night shift answered to Dr. Lawrence Hallberg. Hallberg was the chief of surgery. He was 61 years old, a graduate of a medical school the framed diploma on his office wall reminded everyone of, and he had been at Balboa for almost 3 decades. He was, by any technical measure, a skilled surgeon. He was also a man who had spent 30 years working inside the same institution without ever once being meaningfully challenged on the way he spoke to the people beneath him, and the particular shape his personality had taken in the absence of that challenge had been allowed to set, like concrete, into something that everyone on the floor recognized, and almost no one knew how to push back against. Hallberg believed that nurses were assistants. He believed that female nurses were assistants of a slightly more specific kind, and he expressed both of those beliefs through the small, consistent currents of language and behavior that accumulated, over time, into a working environment that the women on his rotation managed by avoidance. He addressed the male attendings by their first names. He addressed the female nurses as honey, sweetheart, and in his more impatient moments by no name at all. He had a particular distaste for any nurse who showed signs of independent judgment in a trauma bay, and that distaste expressed itself most reliably through public correction. He preferred to correct in front of the entire team. He believed it was instructive. Nora had been the subject of his public correction 4 times in 14 months. The first time, 3 weeks into her employment, she had drawn up a medication dose at the verbal order of the receiving physician, and Hallberg had reviewed the dosage, told her in front of 2 corpsmen that she had drawn it wrong, and stood over her while she drew it again. She had drawn it the second time exactly as she had drawn it the first. He had nodded as if she had learned something and walked away. The second time, 4 months in, she had questioned the placement of a chest tube on a patient with anatomy that suggested the tube was at risk of malpositioning, and Hallberg had told her, in front of the entire night shift, that perhaps when she had finished medical school herself, she could weigh in on surgical placement. And until then, she could focus on the side of the equation that involved holding the patient's hand. The chest tube had needed to be repositioned an hour later. He had not mentioned it again. The third time and the fourth time had been smaller. The accumulation was not. Nora had absorbed all 4 occasions without visible reaction. She did not respond when he addressed her as honey. There was no rise in her voice when he corrected her on dosages that she had calculated correctly. She simply moved when she was told to move, drew what she was told to draw, and continued doing her job inside the small operational footprint that he was willing to grant her, which was small but functional, and which allowed her to do the work she had come to Balboa to do, without escalating the situation into something that drew further attention. Diane Royer had figured Nora out within about 6 weeks of her arrival, or thought she had. What Royer had noticed about Nora Whitlock was that the woman did not move through a trauma bay the way a 14-month nurse moved through a trauma bay. She moved through it the way someone who had been in a great many high-stakes rooms moved through them, with an economy of motion and a quietness of observation that suggested a history her resume did not account for. Royer had also noticed that Nora's hands did not shake during codes. Nora Whitlock's hands had never started. Royer had filed all of this in the part of her mind that handled curiosities and had not pursued any of it. One of the senior corpsmen, a former Marine named Vasquez, had once watched Nora Field improvise a pressure dressing on a stab wound using a folded sterile drape, a length of gauze, and the patient's own belt as a compression strap. Vasquez had said nothing at the time. Later that night, in the break room, he had looked at her over the top of his coffee and said, "You've done that before." And she had looked at him steadily and said, "You learn things in 14 months. And he had nodded once and let the subject drop. The hospital absorbed Nora the way large institutions absorbed quiet, capable people. It used her, it paid her, and it did not ask questions she had not invited it to ask. In 14 months she had achieved precisely the kind of life she had set out to achieve when she had taken the job, which was a life that ran on quiet, predictable rails, and did not require her to think about anything that had happened to her before she came to it. On the morning of October 17th, Nora arrived at Balboa at 5:28. The trauma wing was in its low-energy pre-shift rhythm. 2 patients from the night before had been admitted upstairs, the bays had been turned over, and the supply carts had been restocked in the methodical way that good night shifts handed off to good day shifts. It was, on its surface, going to be an ordinary Wednesday. The first incident of the morning was small, and would not have registered as an incident at all, to anyone who was not paying close attention. At 6:15, an elderly retired chief petty officer named Harlan came into the bay complaining of chest pain and shortness of breath. The attending, a younger man named Dr. Pham, ran through the standard cardiac workup with the systematic patience the situation called for. Hallberg, who happened to be in the wing for a pre-op consult on a different patient, walked past Bay 3, glanced at the monitor over Harlan's bed, and asked Dr. Pham why he was running a cardiac workup on a patient whose presentation was clearly pulmonary. Its primary purpose was not the answer, but the dynamic the question created. The public posing of a senior figure's contrary opinion in a way that put the junior physician in the position of either defending his choice or quietly switching course in front of his team. Pham, who was 31 years old and 4 months out of residency, hesitated. Nora was setting up an IV line in the corner of the bay, and she did not look up. She continued threading the catheter, finished securing it with tape, and then said, quietly enough that it could have been heard only by Fam if anyone had wanted to interpret it that way, that the patient's elevated troponin from the rapid panel had come back 90 seconds ago and was sitting at 4.2. Fam looked at the monitor. Fam looked at Nora. Hallberg looked at Nora. "You read the panel, honey," Hallberg said. Nora finished taping the line. "The result populated in the chart at 6:12, she said. "Dr. Fam was about to verify it when you came in." It was a flat, factual statement delivered in a voice that contained no emotion and no defense and no apology. And what it accomplished was to make the moment immediately about the data rather than about Hallberg's contrary read of the patient. Fam confirmed the troponin and ordered the cardiac team upstairs. Hallberg stood in the doorway for an additional 3 seconds, his expression suggesting that he was deciding whether to escalate the conversation or to walk away with his authority intact. And then he walked away. Harlan went upstairs to cardiology 20 minutes later. He survived a non-ST elevation myocardial infarction that, on the most reasonable read of the morning, had been caught and treated in part because a senior surgeon had been corrected, in a manner he could not formally object to, by a nurse he had spent the better part of a year publicly addressing as honey. Hallberg did not forget the moment. Nora knew that. The experience of being made, even softly, into the second most correct person in a doorway was not an experience he was going to file away neatly. The radio call came in at 10:40. Inbound naval air. Osprey from offshore. Estimated arrival 7 minutes. 1 liter. Adult male. Chemical exposure with thoracic involvement. Critical. The dispatcher's voice came through the trauma bay's overhead speaker with the controlled neutrality of someone reading a weather report, and the floor responded the way Balboa's trauma floor responded to inbound critical patients, which was without panic, with motion, with the systematic distribution of preparation tasks across every member of the team, within the sound of the call. Diane Royer was at the central station and had her radio in her hand within 4 seconds of the announcement, asking the dispatcher for repeat detail on the chemical exposure and for the patient's known vitals. The answers came back layered and quick. The chemical agent had not been identified in the field. The exposure was reported as a closed-space event with secondary inhalation. The patient was hypoxic, hypotensive, and had what the corpsman was describing as a penetrating thoracic wound of unclear origin sustained during the same incident. The corpsman was a junior second class, and his voice carried the strain of a man who had been fighting to keep his patient alive for 23 minutes in the back of an aircraft, and who was very aware that he was running out of the tools he had been trained on. The detail Royer caught immediately, and that several members of the team caught a beat later, was the word chemical. Balboa was prepared for chemical exposures in the formal protocol sense. The hospital had a decontamination protocol, a small inventory of standard antidotes for the common agents, and the same general training that every Department of Defense medical facility was required to maintain. What Balboa did not have was operational experience with the kinds of agents that occasionally appeared in the medical aftermath of operations the Pentagon did not formally discuss in front of cameras. Those cases, when they came with people in the helicopter who knew more about what had caused the injury than they were able to tell the receiving team. The Osprey came in low over the harbor at 10:47. The double rotors were audible inside the trauma wing long before the aircraft itself was visible. The heavy syncopated thump of the tilt rotors carrying through the walls and across the helipad, in a sound that was distinct from any other aircraft in the Balboa rotation. Nora was at the supply cart along the eastern wall of the bay area when the sound first registered. Her hand paused for a half-second over the package of decontamination wipes she had been reaching for, and then continued and picked them up. She moved toward the prep station and began assembling the kit the protocol called for, working alongside Vasquez, who had been pulled into the bay by Royer the moment the call came in. Vasquez glanced at her once as they worked. "You've been on a chemical case before," he said. "Once or twice," Nora said. "Here." "No," she said. He did not ask the obvious follow-up. He took the kit she handed him and went to the door of the bay to wait for the litter to come through. Outside, on the helipad, the Osprey settled onto its struts in a tight, controlled landing that sprayed a fine mist of dock water across the perimeter. The aircraft's rear ramp came down before the rotors had fully wound, and the litter team moved fast across the helipad in the choreography of an operation that had been practiced and rehearsed, and was now being executed under pressure. 2 corpsmen carried the front of the litter. The flight medic walked along the left side with one gloved hand on the bag he was using to support respirations. A 4th man, in a flight suit that did not match the standard naval medical uniform, walked along the right side of the litter without touching it, his eyes scanning the perimeter of the helipad and the entry to the trauma corridor in the methodical pattern of a man who was responsible for the patient's security even after the medical handoff began. He carried a small black case in his right hand. He did not speak. The litter came through the eastern bay doors at 10:51. The corpsman and the flight medic carried it through fast and steady, and the man on the litter was unconscious and gray, wearing what was left of an operational uniform that had been cut open down the front during the flight. The wound was on the left lateral side of the rib cage, between the 4th and 5th ribs, bubbling thinly with each shallow breath, the kind of bubbling that meant air was moving through the wound itself instead of through the trachea the way air was supposed to. His skin had a faint sheen of something that was not sweat. His pupils, when the flight medic peeled back one eyelid, were small and unequally responsive. The flight medic spoke fast and clean as the litter was transferred to the Bay 1 gurney. 26-year-old male, he said. Combat exposure during a closed space breach approximately 90 minutes ago. Unknown agent, inhalational route. Penetrating wound to left lateral chest. Suspected secondary to debris from the same incident. We've been supporting respirations with bag for 21 minutes. Last set of vitals 2 minutes out. Blood pressure 70/40. Heart rate 138. Sat 86 on supplemental oxygen. He's been seizing intermittently for the last 15 minutes. The team moved around the gurney in the choreographed way Balboa's trauma team moved around critical patients. Pham took the head, called for intubation kit, called for chest tube tray. Royer called for additional lines, called for the rapid blood panel, called for someone to find Hallberg. Vasquez moved to the patient's right side and began cutting away the remaining uniform from the chest and arms. Nora moved to the left side of the gurney, on the opposite side from the chest wound, and her hands were on the patient before she had consciously chosen to put them there. She knew the smell. It was not a smell most people would have known, and it was not a smell most medical professionals would have known. But Nora Whitlock had spent 6 years of her life in environments where she had been required to learn the smells of certain compounds, and the smell coming off the patient's skin in the closed warmth of the bay was a smell she had encountered 4 times in those 6 years, 3 times in operational debriefs, and once at a distance, she had been told not to approach. It was the smell of a particular binary compound that broke down into a fast-acting cholinergic agent on contact with moist tissue, used by exactly 2 non-state actors in the world, and it was not a compound she had expected to ever smell again. Her face stayed neutral. Her hands moved. She reached for the decontamination wipes on the side cart, called for atropine, in the same flat voice she had used to call out the troponin level 4 hours earlier, called for pralidoxim in a dose she did not have to look up, and began wiping down the exposed skin on the patient's neck and the inside of his forearms with the systematic, methodical pattern of someone who had been trained to do exactly this with no time to think about it. Pham paused for a fraction of a second to look at her. Pralidoxim, he said. 2 grams intravenous. Push slow, Nora said. And atropine. 2 milligrams to start. Repeat every 5 minutes until secretions dry. He has been exposed to an organophosphate analog. The seizure pattern fits. The pupil findings fit. We need to dose him in the next 60 seconds or we lose the window. Pham looked at her. She did not look up. Her hands kept moving. The man in the flight suit had come through the bay doors a step behind the litter and had stopped just inside the room. He stood with his hands at his sides and the small black case still in his right hand. His eyes had gone first to the patient, and then, after a moment, to the woman on the left side of the gurney calling out the antidote dosing. His face did a particular thing in that moment that no one in the bay was paying attention to. It was the look of a man who had spent the last hour of a long aircraft transit, rehearsing the briefing he was going to give the receiving team about the patient's exposure history, and who had just walked into a bay where a 14-month nurse was, with no prompting from him, identifying the compound he had been about to brief them on. by name and by mechanism, and dosing the antidote at battlefield protocol. He did not move. He waited. It was at that moment that Hallberg came through the bay door. He had been pulled out of his pre-op consult by the announcement, and he came into the bay with the particular controlled urgency of a senior physician arriving at a scene he intended to take command of. He took in the configuration of the room in a single sweep. The patient, the team, Pham at the head, Vasquez on the right, the open intubation tray, the bag still being squeezed by the flight medic, the chest wound bubbling under a temporary occlusive dressing, and his eyes landed on Nora at the patient's left side, calling out a medication order to the attending in a voice that did not sound like the voice he was used to hearing from her. Hallberg's face did a particular thing in that moment that several people on the team would later describe in different ways. The closest version of it was the look of a man whose entire understanding of how a room worked had just been contradicted by the room itself, and who had decided, in the span of about 2 seconds, to correct the contradiction by force. "What are you doing?" he said. His voice carried. Not loud the way a shout was loud. Loud the way a senior surgeon's voice was loud when he intended every person in a 50-foot radius to stop what they were doing and listen. Hallberg crossed the bay in 4 steps. "I asked you a question," he said. "Dr. Hallberg," Pham said, and his voice was the voice of a younger physician trying very hard to redirect a situation, the agent. "I am not talking to you, Pham," Hallberg said. "I am talking to her." He was now standing directly across from Nora, with the patient between them. The patient's chest rose and fell shallowly under the flight medic's bag. The monitor above the bed showed a heart rate of 136, a blood pressure that had not yet been confirmed by the floor cuff, and an oxygen saturation that had crept up by 2 points since the patient had been transferred to wall oxygen. "What are you pushing into my patient?" Hallberg said. "Atropine," Nora said. 2 milligrams. We're going to need pralidoxime in the next 30 seconds. Hallberg's hand came across the gurney and closed around her wrist before she could withdraw the empty syringe. "You do not push medication into a patient in my trauma bay without my order," he said. "You are a nurse. Do you understand what that word means? It means you stand where I tell you to stand, and you give what I tell you to give. It does not mean you guess at antidotes. Do you understand me?" Nora did not pull her wrist away. She did not look at his hand. She looked at his face. Her own face, in the soft fluorescent light of the bay, was very still. "He has been exposed to a cholinergic agent," she said. "The presentation is textbook. His pupils are constricted. He is hypersecreting. He has been seizing, and he is bradycardic underneath the tachycardia his sympathetic response is producing. He is going to die in the next 4 minutes if he does not receive atropine and pralidoxime, in that order, in standard battlefield dosing." Dr. Pham was about to come to the same conclusion. "I gave him the dose. The second dose will need to be given in 5 minutes. The floor will need to call CDC for confirmation on agent identification, and we will need a secondary decontamination set up before this exposure spreads further into the team." Hallberg's grip on her wrist tightened. The room had gone very quiet around them. The flight medic was still squeezing the bag, but his eyes were moving back and forth between Hallberg and Nora, and his hands had developed a small controlled tremor. "Get away from my patient," Hallberg said. "Doctor," Pham said. "Get away from my patient," Hallberg said again, and this time it was a shout, and the shout filled the bay in the particular way that the shout of a senior surgeon filled a room he had spent 30 years owning. And even Royer, at the door of the bay, did not immediately move to intervene because the chain of command on a trauma floor of a naval hospital did not have a clean lane for the charge nurse to interrupt the chief of surgery in the middle of a public correction. Through the doorway of the bay, 8 feet behind Hallberg and slightly to the side, the man in the flight suit had been watching the entire exchange. He was somewhere in his late 30s or early 40s, built lean and hard, the way men who had spent 20 years carrying gear and running ridgelines were built lean and hard. And he was still in the harness and partial kit he had been wearing in the back of the Osprey. There was salt crust on the cuffs of his flight suit from a long aircraft ride at altitude. There was dirt on his boots that had not come from anywhere on the Naval Medical Center campus. The unit designator on his shoulder was not one the trauma floor at Balboa saw with any frequency. His eyes, behind the controlled fatigue of a long aircraft transit and a longer day before that, were taking in the bay with the methodical attention of someone who was not going to forget any detail of what he was seeing. He had been about to step forward and brief the receiving team on the patient's exposure history. Because his man on the gurney was a senior chief, he had served alongside for 7 years, and he had not flown an Osprey 800 miles from offshore to lose him in a trauma bay at Balboa. Then he had heard the surgeon shout. Then he had heard the surgeon shout a second time, and he had seen the woman at the left side of the gurney correctly identify, by smell and by symptom pattern, the precise compound he had been preparing to confidentially brief the receiving team about. And then he had seen her face in the bay's overhead light, and he had stopped where he was standing in the doorway, and he had not moved, because the woman calling out the antidote dose at the left side of the gurney was a woman he had last seen 7 years and 4 months ago in a forward operating location in a country he was not allowed to name, in a room where she had been giving orders to him. He stepped into the bay. 2 words. He said them clearly, with the precise emphasis of a man who had spent his entire adult life on a radio. Cipher actual. The bay did not so much go quiet as develop a particular quality of stillness that was different from quiet. Quiet was the absence of sound. The stillness in the bay was the active suspension of everyone in it. The flight medic continued to squeeze the bag, because the flight medic was the only person in the room who did not yet understand what had just happened. Everyone else understood that something had happened, even if most of them did not yet understand what. Hallberg understood enough. He did not let go of Nora's wrist immediately. He did, however, do something with his face that was very small and very fast, the involuntary readjustment of a man who had just felt a structural element shift somewhere underneath his understanding of the room, and who was rapidly trying to determine how much of his footing had moved. The man in the flight suit took 2 more steps into the bay. He did not look at Hallberg. He looked at Nora, and the look was the look of a man who had spent 7 years not knowing whether the woman he had once reported to was alive or dead, who had spent the last hour realizing that he had been about to walk into a bay where she was working, and who had then watched her, in the first 30 seconds of his arrival, identify a compound that he had personally confirmed in the rubble of an objective 4 days ago. "Ma'am," he said. His voice was lower now. It was the voice of a man addressing a senior officer in a public space and being precise about it. "Glad to see you." Nora looked at him. The room saw her face change. It was not a large change. It was the kind of change that someone who had spent the last 14 months keeping her face under perfect control allowed herself to make for exactly 1 second before she put the control back in place. Then she looked at Hallberg's hand on her wrist. "Sir," she said, "my patient is dying. You are going to remove your hand, or I am going to remove it. We have approximately 110 seconds before the next intervention window closes. I would prefer not to spend any of them on this." Hallberg's hand opened. She took the syringe from the courseman behind her, drew up the pralidoxim in a smooth, efficient motion that no one in the bay would later be able to remember the individual steps of, and pushed the dose into the IV port at the left antecubital line. Her voice called for the second wave of decontamination, then for the chest tube tray to be opened. To the flight medic, without looking at him, she said he was doing well and was about to be relieved of the bag. Pham, quietly, was told he had the airway. Vasquez, on the right side of the gurney, received the exact placement and depth for the chest tube, and listened to her the way he would have listened to a senior attending whose orders he had followed for a long time. The patient's heart rate began to drop within 90 seconds of the atropine dose, dropping out of the compensatory tachycardia and into a more sustainable rhythm. His oxygen saturation, with the airway secured and the chest tube placed, began a slow climb from the high 80s into the low 90s. He stopped seizing 4 minutes after the pralidoxim had been pushed. He was, by any reasonable read of the monitors in the bay, no longer in the process of dying. Hallberg stood across the gurney with his arms at his sides, and his face frozen in the particular neutrality of a man who had not yet decided which version of himself he was going to be on the other side of the next 5 minutes. Royer, at the door of the bay, was looking at Nora the way you looked at a coworker you had spent 14 months working alongside without ever really seeing. The flight medic was crying quietly without seeming to know he was crying, the way junior medics sometimes cried when they understood for the first time that the man they had been keeping alive in the back of an aircraft was actually going to live. The man in the flight suit stayed where he was, just inside the bay door, with his hands clasped loosely in front of him, waiting for the woman at the left side of the gurney to tell him what she needed him to do next. She would tell him in a minute. The patient was first. Nora Whitlock did not look up from her work. The senior chief on the gurney was moved out of the bay at 11:09, 18 minutes after the praladoxim had been pushed, on a route through the long corridor and up the surgical elevator to the operating suite on the 3rd floor, where a vascular team Hallberg himself had assembled on his radio in the 4 minutes between his hand opening on Nora's wrist and the patient becoming stable enough to transport, was waiting in scrubs to receive him. The transport itself was clean and fast. Vasquez took the head of the gurney. Pham walked alongside it with one hand on the IV pole and one hand on the radio he was using to update the OR. Hallberg did not follow. He had stepped back from the gurney the moment Nora's hands had begun moving, and he had stayed back as the chest tube went in and the praladoxime took hold, and he had not spoken again. When the gurney left the bay, he stood where he had been standing for the last 12 minutes, his hands flat against the side of the supply cart, his face turned toward the bank of monitors that had now gone dark with the patient's departure. He stood like that for a long moment. Then he turned, without looking at Nora, and walked out of the bay through the side door that led to the surgical corridor, and he did not say anything to anyone he passed on the way. The man in the flight suit had not moved from the doorway. He waited until the gurney had cleared the bay, and the immediate team had disappeared into the corridor. And then he took 2 steps forward, and stopped at what would have been a respectful distance for an officer addressing a superior in a public space. "Ma'am," he said. Nora was standing at the gurney that the patient had just been removed from. She was still wearing the gloves she had used during the intervention. There was a small smear of the patient's blood on her left forearm just below the cuff of the glove, and she was looking at her own hands the way a person looked at her hands when she had not used them in a particular way for a very long time and was checking to see if they remembered. She looked up. "Commander," she said. He took a small, careful breath. "It is Commander now," he said. "It was Lieutenant when we last spoke." "I know. Drake." There was a small pause in the room. Royer was at the door of the bay, watching them without making any pretense of not watching. The flight medic had not yet quite caught up to what was happening. Through the side window of the bay, the afternoon light was changing over the harbor. "Where would you like to do this?" Holloway said. "The break room is private," Nora said. "Most of the floor will be tied up upstairs for the next hour." He nodded once and gestured for her to lead. She did not move immediately. She looked at Royer. "Diane," she said, "the bay needs to be reset for the next intake. The flight medic should be debriefed and given a chair and something to drink. Vasquez will be back down from upstairs in about 15 minutes. I will be in the break room with Commander Holloway. If administration calls down for me, route the call there." Royer, who had been a charge nurse for 19 years and who had seen a number of unusual mornings in that span, took a small breath and said, "Yes, ma'am." Nora paused at the word. "Diane," she said quietly, "I am still Nora." "You are still Nora," Royer said. "But ma'am is going to come out for the rest of the shift. I will work on it." The break room at Balboa was a narrow space at the back of the trauma wing, with 2 vending machines, a refrigerator that staff had been threatening to clean out for the last 6 months, and a small round table beside a window that looked east across the rooftops of the medical center toward the bay. Nora made coffee in the cheap institutional drip machine and poured 2 cups. She set one in front of Holloway, who had taken the chair at the table that put his back to the wall and his eyes on the door, and she took the chair across from him. He looked at her for a moment without drinking. "You are very far from where I last saw you," he said. "I have been for 6 years. "We thought you were dead," he said. "For about 8 months. We actually thought you were dead. Then we thought you had been pulled. and Helen would not confirm or deny. And the unit settled into the assumption that you had been reassigned to something we could not be read into. None of us came up with the version where you became a civilian nurse at Balboa. It was not the plan, she said. What was the plan? He said. Nora wrapped her hands around her coffee. The coffee was bad, which was a comfort. The break room was bad in the specific way that hospital break rooms were bad everywhere, which was also a comfort. The plan was to disappear. Holloway nodded. He was quiet for a long moment. He took a small sip of the coffee and put it back down with the care of a man who did not actually drink coffee, but who had accepted it because it would have been impolite not to. Daniel Reeve, he said. Yes. The look that Helen had to give you. After. I was not in the room when she gave it. But I have seen Helen give that look one other time, to a different officer, and I know what it looks like on her face when she has to tell someone what she had to tell you. Nora's hands tightened around the coffee cup. Her face did not change. I did not blame her, she said. The intel was what it was. I made the decision with what we had. I would make the same decision today. You would, Holloway said. That is not what I came here to tell you. What did you come here to tell me? He took a breath. There is a recovery room on the 3rd floor where Senior Chief Marcus Reeve will be coming out of anesthesia in about 3 hours, Holloway said. He has been on my team for 4 years. I have known him longer than that. I want you to be in that recovery room when he wakes up. Why? Because he has been carrying something for 9 years, Holloway said, and I think you should be the one to hear him say it. There was a knock at the break room door. Royer opened it without waiting for an answer. She was wearing the particular expression that a charge nurse wore when something had happened in the wing that she had not yet had time to fully prepare for. There are 2 people from administration at the central station, she said. They want to see you. Who? The Chief of Staff, Dr. Welk, and his administrative deputy. They are not asking nicely. Holloway, who had been about to say something else, paused. He looked at Nora. If you would like me there, ma'am. I would, as an observer. Please do not speak unless I ask you to. Yes, ma'am. They walked out of the break room together. The central station of the trauma wing was on the other side of the main corridor, and the 2 figures standing at it were visible from a distance. Dr. Welk was a tall, thin man in his mid-50s, with the particular institutional ease of someone who had spent 20 years calibrating his professional identity inside a single building. His deputy, a woman with a tablet and a closed expression, was standing 2 paces behind him. Welk turned as Nora approached. Nurse Whitlock, he said. Yes, we need to speak with you in my office. I am available now. Welk's eyes moved past her to Holloway, who had stopped 2 paces behind her and slightly to the side in the posture of a security detail. Sir, Welk said. This is a private hospital matter. Holloway did not respond. He looked at Nora. He is with me, Nora said. Welk's expression did not quite shift, but the small muscles around his mouth tightened in the particular way they tightened when an institutional figure was being told, by someone several pay grades below him in the hospital hierarchy, that the institutional ground rules had quietly changed. This way, he said. Welk's office was on the 2nd floor, with a window that looked out over the campus. The chair on the visitor's side was lower than the chair on his side. He took his seat behind the desk. His deputy took a chair against the wall and opened her tablet. Welk did not invite Nora to sit. She sat anyway. Holloway remained standing behind her chair. Nurse Whitlock, Welk said. An incident has been reported in Trauma Bay 1 this morning. The chief of surgery is currently in his office. He has not yet given us a complete account. What he did give us was that you administered medications, without his authorization, to a patient under his care, that you addressed him in a manner he characterized as insubordinate, and that you appear to have professional credentials and a personal history that are not consistent with what the hospital's personnel file on you contains. Is any of that accurate? Some of it, Nora said. Welk waited. I administered atropine and pralidoxime to a patient I had correctly identified as suffering from a cholinergic agent exposure, she said. Dr. Pham was the attending of record and had not yet objected to the dosing. The patient was in active seizure with a roughly 4-minute survival window. Dr. Halberg arrived after the first dose had been administered and attempted to stop the second. He physically restrained my wrist. I asked him to remove his hand. He removed it. The patient was stabilized and transferred to surgery. He is currently alive. Welk's deputy was typing. Dr. Halberg has filed a complaint, Welk said. He is requesting your immediate suspension pending investigation. I would expect him to. Welk leaned forward. Nurse Whitlock, he said. I have spent the last 20 minutes attempting to reach the agency that the Federal Medical Services entry on your resume references, and I have been politely informed by 3 different people that the entry is genuine, but that no further detail will be forthcoming. I have called the Tacoma reference. The Tacoma reference confirmed your competence and ended the call. I do not know who you are. I do not know why you are in my hospital. What I do know is that this incident, as it is currently being described to my office, has the potential to be a significant problem for this institution, and I would like you to help me understand what I am dealing with. Holloway took a small step forward. If I may, sir. Welk's eyes moved up. Holloway pulled a folded sheet of paper from the breast pocket of his flight suit and set it flat on the edge of the desk. It was a standard authorization letter on the kind of paper that did not have an institutional letterhead, because the institution that produced it did not formally exist on the kind of letterhead Welk was used to seeing. The patient who was brought into this hospital this morning is operating under classified status, Holloway said. The exposure event was operational. The dosing protocol that Nurse Whitlock executed was correct by the standard of the agencies that are responsible for casualties of this type. My command has been in contact with your hospital's general counsel since the moment we were 2 minutes out from your helipad. The contact will continue. I am not at liberty to discuss the operational background of the patient, of the exposure, or of Nurse Whitlock, with you, or with Dr. Halberg, or with anyone else who does not hold a sufficient clearance. What I am at liberty to tell you is that Nurse Whitlock's intervention this morning saved the life of a service member whose continued life is a matter of operational interest at a level above this hospital. You will receive formal communication from my command's legal office before the end of this business day. Welk read the letter. He read it twice. The deputy stopped typing. Welk looked up. Dr. Halberg's complaint, he said carefully. Dr. Halberg's complaint, Holloway said, will be addressed by the appropriate channels within this hospital. Nurse Whitlock will not be suspended. She will return to her shift. The events of this morning, to the extent that they are not classified, will be documented per standard hospital protocol. Anything that touches on the patient's operational background will be redacted by the agencies of jurisdiction. Are we clear? Welk's deputy had closed her tablet. We are clear, Welk said. They walked out of Welk's office in silence. The deputy did not follow them. The hallway on the second floor was empty. Holloway waited until they were inside the elevator, and the doors had closed before he spoke. I am sorry, ma'am. For what? For burning your cover. Whatever was left of it. There was a small pause. It was not going to last forever, Nora said. Today. Tomorrow. It was going to come apart on its own eventually. You did not deserve to have it come apart this way. She looked at him in the elevator's small reflective wall. Drake, the job in front of me is to walk into a recovery room and listen to a man tell me something. After that, I will worry about the rest of it. Right now, I am still the nurse who pushed the dose. Let me keep being her for the next 3 hours. Yes, ma'am. The recovery room on the 3rd floor was quieter than the trauma bay. The lighting was softer. The monitors made their low, steady noises, and the post-anesthesia nurses moved between the curtained bays in the careful, unhurried rhythm that recovery rooms required. Senior Chief Marcus Reeve was in Bay 3, with a fresh chest tube draining clear, a slow IV running, and an oxygen cannula seated comfortably at his nose. The chest wound had been closed. The exposure had been declared resolved, with continued monitoring of cholinergic markers for the next 48 hours. He was 26 years old. His face, with the anesthesia mostly cleared, looked younger than that. Holloway had walked Nora to the door of the recovery suite and let her enter alone. She approached Bay 3 slowly. The post-anesthesia nurse on duty, a young man named Carver whom she did not know well, looked up, recognized her, and nodded once with the particular careful courtesy of a colleague who had heard the story of the trauma bay and had not yet decided what to do with the information. "He is just starting to come up," Carver said. "Maybe 5 minutes. I will wait." Pulling the chair to the side of the bed, she sat. Marcus Reeves' hand was within reach. She did not take it, because she did not know him yet, but she leaned forward and put her own hand flat on the side rail of the bed where he could find it if he came up reaching for someone. It took 6 minutes. His eyes opened to a slit. He blinked. He turned his head, slow against the pillow, and his eyes found her. They did not quite focus. "Hey," she said. "You are at Balboa. You are safe." His lips moved. He said something that did not have any sound in it. She leaned closer. "Cypher," he said. His voice was a paper-thin rasp. "You found me," he said. Nora went very still. His eyes closed for a moment. He opened them again. He was struggling against the anesthesia, against the meds, against the kind of fatigue that came after a body had been near death for 90 minutes, and was now trying to figure out which side of the line it was on. "Daniel said," he said. "Daniel said what?" Daniel said. The room got a little wider. His eyes drifted, then came back. "Daniel said you would not stop. Said if anybody made it through, it would be because of you. I wanted to come find you. Marcus, Daniel is gone. He has been gone for 9 years. His head moved against the pillow. It was a small movement, but it was clear. "No," he said. Nora's mouth opened. He came back. She did not say anything. The recovery room around them continued to make its small, steady noises. A monitor at another bay chimed. A nurse spoke quietly to a patient 2 curtains over. Marcus Reeves' eyes had closed again. She thought for a moment he had gone back under. Then they opened. 9 months, he said. After. Found him. Different unit. He was bad for a long time, but he came back. He has been looking for you, Cypher. He has been looking for you ever since. The recovery room had narrowed to one small bright point. That was the face of the man in the bed. "Where?" she said. His eyes closed. Marcus. His breathing evened. He had gone back under. She sat there. The hand that had been resting on the side rail did not move. The hand that had not been on the rail had come up at some point and was pressed flat against her mouth. And she was breathing slowly and steadily through her nose, the way she had learned to breathe a long time ago in a different life, when something in front of her was too large to hold all at once, and she needed to hold it in pieces. Holloway came into the recovery room sometime later. He stood at the curtain. He did not speak. He let her have whatever time she needed. When she finally stood, the chair scraped softly. She turned to him. "You knew," she said. "I knew. How long?" "We confirmed Daniel 6 years ago. The unit kept it quiet for operational reasons. Helen was the one who held the line. She thought you needed time. She thought if she told you while you were still raw, you would come back too fast, and she did not want you to come back for the wrong reason. By the time we thought you were ready, you were gone. None of us could find you." Nora's voice was very quiet. "He has been looking for me for 6 years. "Yes, ma'am." "Where is he, Holloway?" "He is in Bethesda. He is on light duty. He has been on light duty for a long time. He stopped looking actively 3 years ago. He has not stopped wanting to find you. He has just stopped expecting it." Nora was looking past him at the wall of the recovery room. "Drake." "Yes, ma'am. I need you to tell me how to call him." Holloway reached into the inside pocket of his utility jacket and pulled out a small white card. He had written a number on the back of it, in his own handwriting, in clean block print. He held it out to her. "I have been carrying this for 6 years," he said, "in case I ever found you." I never thought I would." She took the card. She looked at it for a long moment. Then she folded it once, carefully, and put it in the inside pocket of her scrub jacket. She did not call Daniel that day. There was an order of operations to what she had to do, and she knew it. And the conversation with Daniel was the last thing on the list, because it was the conversation she could not begin from a half-finished place. She finished her shift. She did not know how, but she did. The trauma bay had a steady afternoon of ordinary work. 2 cardiac complaints, and a laceration, and a child with a febrile seizure that Dr. Pham and Royer handled with quiet efficiency. And Nora moved through it the way she had moved through every shift before this one, except that the people around her now moved around her with the small, careful adjustments of staff who had seen something they could not unsee. Royer did not say anything direct. Vasquez nodded at her once across the central station, with the particular brief acknowledgement of a man who had just had a long-standing suspicion confirmed and had decided that no further commentary was required. Pham, when he passed her in the corridor at one point in the afternoon, slowed slightly, met her eyes and said only, "Ma'am," and kept walking. She clocked out at 7 that evening, drove home, and did not call. Showered, ate, sat at her kitchen table with the card in front of her, and did not call. She slept. The next morning at 5:30, she came back to Balboa as she had every morning for 14 months. Hallberg was waiting in the corridor by the trauma wing. He was not in a posture of ambush. He was leaning against the wall opposite the door to the wing, in the particular tired, patient way of a man who had been waiting for some time. And when he saw her, he did not approach her. He waited for her to approach him. "Nurse Whitlock," he said. "Dr. Hallberg." He took a breath. The breath was longer than it needed to be. "I have been here since 3, he said. "Why? Because I did not sleep. And because I owe you a conversation that I would prefer to have at this hour, when there are not very many people in the building to watch us have it." Nora considered him. He looked tired in the specific way that men in their 60s looked tired when they had not slept and had spent the hours of not sleeping going over the events of a day they could no longer change. His tie was perfect. His coat was clean. His face was not. She moved to the small alcove beside the wing door, the one with 2 chairs and a defunct vending machine where staff sometimes sat in the early morning to drink coffee before the floor came up. She sat in one of the chairs. He took the other. "Dr. Hallberg, I am going to say something," he said, "and I would like you to let me finish before you respond, because I have rehearsed it in a particular order, and if you interrupt me, I will lose the order. Will you allow me that?" "Yes." He took another breath. "I have been a surgeon at this institution for 29 years. I have been the chief of surgery for 14 of them. In that time, I have developed a manner of speaking to nursing staff, and to female nursing staff in particular, that I have always told myself was a function of efficiency. I told myself that I did not have time to be polite. I told myself that the work was what mattered. I told myself that the women on my rotation understood the dynamic and could handle it. I told myself a number of other things. None of them, when I sat in my office last evening and went over what happened in that bay yesterday, were true." Nora did not speak. "You corrected me yesterday morning on a cardiac case," Hallberg said. "You corrected me in front of a junior attending and a corpsman. You did it softly. You did it in a way that did not require me to acknowledge that I had been corrected, and I did not acknowledge it. And I walked away from that bay holding a grudge against you that had nothing to do with the patient, and everything to do with the fact that I have spent 30 years building a version of myself in this hospital that does not tolerate being corrected." He paused. "When the senior chief came in, I had already decided that I was going to put you in your place. I did not know I had decided that. But I had. And when I walked into that bay and I saw you giving orders, I did not see a competent professional handling an exposure that you understood, and I did not. I saw the woman who had corrected me 4 hours earlier doing it again. I put my hand on you. I am not going to ask your forgiveness for that, because I do not deserve it. I am going to tell you that I will be filing a letter with the hospital board this morning resigning my position as chief of surgery, effective at the close of this fiscal quarter. I will remain on staff as a surgeon until I retire. I will not be in a position of authority over you or over any other nurse on this floor again. He stopped. He waited. Nora looked at him. She thought about a number of things she could say. The version of the response that would punish him. The version that would crush him. The version that would close the door cleanly and walk away. There was Daniel Reeve, alive in a hospital in Bethesda for 6 years, and not knowing where she was. There was Marcus Reeve in the recovery room. There were her own hands at the supply cart yesterday morning. 14 months into a quiet, predictable life that had now, in the span of a single shift, finished being quiet and predictable. Dr. Hallberg, she said. Yes. I am not the right person to receive your resignation. The hospital board is. You should send it to them. If you would like a personal response from me, the response is this. You have done me a particular favor in the last 18 hours, which is that you have forced me, by putting your hand on me in front of a room full of witnesses, to stop hiding. I had been hiding for 6 years. I am not going to thank you for that, because the favor was not deliberate. I am going to acknowledge it. She paused. The nurses you spent 30 years addressing as honey, she continued, are owed something more substantial than a resignation letter to a board. I would suggest, in the time between now and the close of this fiscal quarter, that you find a way to make that something happen. What it looks like is not for me to design, but it should not be a quiet exit. It should be the kind of exit that the women you addressed as honey can see, and can read, and can tell each other about. That is what would matter. He absorbed this. He nodded once. He stood. He looked at her for one long moment. Then he walked away down the corridor without speaking again. And Nora sat in the alcove for another 2 minutes before she got up and walked into the trauma wing to start her shift. The day at Balboa went on the way days at Balboa went on. There were patients. There were charts. There was Royer running the floor with her usual disciplined warmth, and Pham handling the morning rounds, and Vasquez setting up the bays for the next intake. The trauma wing absorbed the events of the previous day, the way the trauma wing absorbed everything, which was by moving forward. At 10 in the morning, Holloway came back through the eastern bay door. He was not in a flight suit this time. He was in a clean utility uniform, and he was not alone. There was a young woman with him, in the same uniform, with a small flat case in her hand. They walked through the wing to the central station where Nora was charting. Ma'am. Yes. The unit asked me to bring you something. He nodded to the young woman, who opened the case. Inside it, on a small piece of dark felt, was a coin. It was a heavy brass piece, struck on both sides, with a design that Nora had not seen in 7 years. It was the unit coin of a task unit that the Pentagon did not formally discuss in front of cameras, and the side that was facing up bore a small set of initials engraved into the brass below the unit emblem. They were her initials. They had been there since the coin had been struck 9 years ago. We have been carrying this for you, Holloway said. Marcus is awake. He is going to be discharged to Bethesda in 3 days. The unit would like to know if you would consider coming to the change of command ceremony in May in a personal capacity as a guest of the task unit. There is no operational ask attached. There is no expectation of any kind. It is an invitation. Nora looked at the coin. She did not take it. I will think about it. That is all we are asking, Holloway said. He closed the case carefully and set it on the counter at the central station, with a small white envelope on top of it, that had her name written on it in clean handwriting. The coin is yours when you are ready, ma'am. There is no deadline. He shook her hand, the way an officer shook the hand of a superior in a formal setting. The young woman did the same. They walked back out through the eastern bay doors, and the trauma wing returned to its work. Nora finished her shift at 7. She drove home. The October light over San Diego was the particular kind of clean that came after a long marine layer had finally burned off, and the harbor was visible from the road for most of the drive. The parking lot of her building was half empty. The 2 flights to her apartment took the time they always took. She let herself in. Her bag went on the chair by the door. The card came out of the inside pocket of her scrub jacket. She sat at her kitchen table. The number on the card was the same number Holloway had written for her the day before. For 14 months, she had thought that the version of herself who had once been called Cypher was a closed file. The version of herself who had walked away from Helen's office at the end of a particular debrief, with a particular piece of information she had not been able to carry, was a version that did not have anywhere else to go. She had been wrong about a number of things in that calculation. The decision in front of her now was small. It was the smallest decision she had been asked to make in 2 days. She picked up her phone. She dialed the number. It rang twice. A voice picked up. The voice was older than she remembered it. It was tired in the specific way that men were tired when they had spent a long stretch of years carrying something they had not been able to put down. It was wary in the way of a man who did not get unfamiliar calls anymore, and did not want to. Hello. Nora closed her eyes. She felt the small, careful breath she had spent 6 years learning how to take in moments that were too large to hold all at once, and she took it now, and she let it go, and she opened her mouth. Daniel, she said. There was a long silence on the line. She waited. She heard, very faintly, the sound of the man on the other end of the line setting something down on a hard surface. The kind of small, careful sound that a person made when his hands had stopped doing what they had been doing because his hands no longer remembered what they had been doing. When his voice came back, it was different. Cypher, he said. She did not say anything for a moment. The kitchen around her was very quiet. The October evening was darkening over the harbor. The window behind her had begun to reflect the small lamp she had left on by the door, and she could see, in the reflection, the silhouette of a woman sitting at a table with a phone pressed against her ear, and the woman in the reflection was someone she had not seen in a very long time. Yes, she said. I am here. The end. If this story moved you the way it moved me to tell it, do me one small favor. Tap that like button so it reaches the next person who needs to hear it. And in the comments, tell me what city or country you're listening from right now, because I read every single one. If you just found Silent Badge's stories, welcome, you're home. Subscribe, and stay close. We tell the stories the world prefers to keep buried, and the next one is already on its way.